Hi fam, it's Dr. Day. Today we're talking female ovarian tumors, but don't get overwhelmed by this chart. We'll go through each one individually and also go over high-yield mnemonics that can help make this stick. Let's look at the ovarian tumor origins first. We have epithelial tumors that come from the surface lining and usually show up in postmenopausal women. Key tumors include serous and mucinous, while the germ cell tumors come from primitive oocytes. These hit teens and young adults, and the important ones to know are dysgerminoma, yolk sac tumor, and teratomas. Lastly, we got sex cord-stromal tumors that come from supporting cells like theca, granulosa, Sertoli, and Leydig, and can happen at any age. Key examples include granulosa cell, thecoma, fibroma, and Sertoli-Leydig. Let's start with serous cis-adenomas. Both benign and malignant forms come from epithelial cells. Benign usually hit middle-aged women and are often asymptomatic with a large adnexal mass. Imaging shows simple cyst with thin walls, and it's pretty easy to remember. Serous equals simple, so remember as simple serous. Malignant serous tumors hit postmenopausal women. Key symptoms include bloating and early satiety, as well as CA-125 being elevated. Imaging will show complex cyst with solid parts, and the buzzword to look out for is psammoma bodies. So think serous psammoma. Next one is a simple one. Mucinous cis-adenomas come from epithelial cells. The classic patient is a young woman with a large mass causing pressure. Imaging will show a multiloculated cyst like a honeycomb, and the buzzword is jelly-like mucin. Endometrioid tumors are up next, that come from epithelial cells with elevated CA-125. The classic case is postmenopausal women with bleeding and pelvic mass plus the bleeding. Imaging will show a solid mass, and it's associated with endometritis. Here we have an aggressive clear cell carcinoma, which is CA-125 and is typically found in an older woman with a rapidly growing mass. The mass itself is solid and complex with smooth projections with nuclei. We're halfway there. Here we have Brenner tumors, which come from transitional epithelium just like the bladder. The classic patient is an older woman with a painless mass, and imaging shows a solid pale mass as shown in the top right. The buzzword to know is coffee bean nuclei on histology, shown by the white arrows. And an easy way to remember is Brenner equals bladder-like equals bean. They all start with B. Now let's break down granulosa cell tumors. Granulosa from the word small grain. They come from sex cord-stromal cells, and its tumor marker is inhibin, which is elevated. The classic patient is a 50 to 60-year-old woman, and symptoms comes from estrogen effects, like bleeding or breast tenderness. Imaging shows solid or cystic mass, and the buzzword is COMLEX bodies, circled in black in the top right, which look like little grainy follicles seen on histology. To remember this, think granulosa grows estrogen, or even better, call Granny Exner for coffee and estrogen. Sertoli-Leydig is next, which also come from sex cord-stromal cells. Sometimes they have elevated inhibin and is usually found in young women. The key symptoms include virilization, like hirsutism, deep voice, and amenorrhea. Imaging shows a solid mass, and the buzzword to know is Ranke crystals. An easy way to remember is Sertoli equals stubble, facial hair from androgen production. Or another way is Sir Lady Diggs crystals. That tells you that there is virilization. This next one is a scary one. It's teratomas, also called dermoid cysts. They come from germ cells and contain all three layers: ectoderm, mesoderm, and endoderm. It's usually found in young women, and her symptoms include pain and risk of ovarian torsion. Imaging shows a mass with tooth or hair inside. That's classic for teratoma. Buzzwords to know include Rokitansky protuberance, which indicates the solid part that protrudes out. So remember, teeth and hair is an easy way to remember this. And remember that terato means monstrous. So think of it like a little teratoma with weird tissues. We're almost there. Dysgerminomas come from germ cells, and the tumor markers to remember are HCG and LDH. The classic patient includes teens or young adults, and symptoms include abdominal pain and a solid mass. The buzzword for this is fried egg cells on histology, where you'll see clear cytoplasm with distinct borders. So the memory hack I created is Dis-German hen lays fried eggs. Dis-German hen lays fried eggs. Hen for HCG, lays for LDH, and fried eggs for the histology. Yolk sac tumors come from germ cells and have very high AFP. They're typically found in kids or young adults, and you'll have a rapidly growing solid mass. The buzzword to remember is Schiller-Duval bodies, which look like glomeruli shown in the top right image. An easy memory trick is yolk equals young plus AFP, or think of A frying pan, AFP, and sac for Schiller-Duval, AFP increased, and found in children. This one I found from Dirty Medicine. Ovarian fibromas come from stromal cells, not epithelial or germ cells. The classic patient is a middle-aged woman who comes in with Meigs syndrome. That's ascites plus pleural effusion with your fibroma, a solid mass. Imaging will confirm that solid mass, and the buzzword is spindle cells on histology. A great memory hack is F for fibroma plus fluid. And you can also remember fibroma. So bro is an amigo. So think fibroma and Meigs. Or just remember fibromap. M for Meigs, A for ascites, and P for pleural effusion. Last but not least, don't mistake a fibroma for fibroids. Fibroids are uterine tumors, not ovarian. Finally, for our last bonus tumor, we have Krukenberg tumors. These are actually GI metastases to the ovaries, so not primary ovarian tumors. The classic patient will have bilateral ovarian masses and have GI symptoms like pain, weight loss, and nausea. Imaging confirms the bilateral solid masses, and the buzzword to know is mucin-producing signet ring cells on histology, as shown in the right. You'll see an example of a signet ring in the middle, and an easy way to remember this is Krukenberg comes from the colon. And that's a wrap on high-yield female ovarian tumors. If you found this video helpful, make sure to like, subscribe, and share with other students who are looking for fast, simple, and clear medical education.